name's Caitlin Mosshart. I will be assessing patient MM, 32-year-old male, for a respiratory assessment. I would have already washed my hands and greeted the patient. Okay, so have you been having any cough at all?
No.
Okay. Any shortness of breath?
No.
Any chest pain at all with breathing?
No.
And have you had any history of any respiratory infections?
No.
And do you smoke or have you ever?
I've never smoked.
And any occupational hazards, like do you have any chance of inhaling any like smoke or particles in the air, pollution, anything like that?
I mean, I feel like the air in Hayes, Kansas is pretty clean. And then I work at the hospital, so I don't feel like there's too much danger of any of that.
Do they provide like proper like PPE, like masks or anything as far as taking care of ill patients? Okay.
Yeah.
All right. And do you happen to know when your last TB skin test was?
I want to say like a year ago.
And that was normal.
Yeah.
Okay. And then did you get a flu vaccine this year?
Yeah.
Okay, well, I'm going to go ahead and just move into like a physical assessment here. I'm going to start on the back side, on your back, listening to lung sounds and looking over everything. So I will start just right behind you here. Okay, just taking a look at the back, just making sure everything is symmetrical. His spine is midline and not noticing any curvature at all. I'm going to just feel behind your back here. All right, have you take a big deep breath in. All right, very good. Expansion is symmetrical. And then if we had shirt off, I'd be also taking a look at skin, noting any lesions, anything like that. But for patient privacy, we will keep your shirt on for this video. Okay, and then I'm going to go ahead and just feel, it's called tactile fremitus, and so I'm going to have you repeat 99 as I move my hands down the back. Okay, go ahead.
99, 99, 99.
One more time.
99.
Perfect. Okay, so I felt vibrations through each side bilaterally and equal. I didn't feel anything one side different than the other. And then I'm just going to kind of feel over the back here. I'm feeling for any crepitus, any bumps, lumps, lesions. Let me know if you feel any tenderness.
No, I don't.
Very good. Okay. All right, and so next I'm going to do what's called percussion. So I'm going to be going across your back. I'm going to kind of sound like a little bit of a pounding as I'm hitting my own finger behind, and I'm listening for the different sounds. I'm listening for resonance. So resonant throughout the entire back. And then now I will go ahead and just take a good listen. As I move my stethoscope to a different spot, just take a deep breath in. All right, deep breath. One more. Very good. Lung sounds really clear throughout the entire back. Around and just look at the anterior chest now. So just noting patient does not look like they're in any distress, non-labored breathing. I could go ahead and check respiratory rate at this time too if I hadn't already done it in my vital signs. But skin color, everything is appropriate. So I will go ahead and just have you, I'm gonna just feel right here. Take a big deep breath in. All right, expansion is symmetrical and equal. A good breath in right there. I'm gonna go ahead and just feel, feeling for any crepitus, any pain or tenderness as I press.
No.
Okay, good. All right, not noting anything abnormal there. I'll go ahead and do the tactile thermometer. So just like we did on the back, I want you to just read 99.
99, 99, 99, 99, 99.
Okay, very good. So everything was normal, felt vibrations bilateral, and they were equal on both sides. Okay, now I'm going to go ahead and do the percussion just like we did on the back. Okay, so resonant, there could be, because of the heart, could have some dullness in that cardiac area as well, so that could be normal. I will go ahead and just take a listen to the lungs now. Just like on the back, as I move my stethoscope, just take a deep breath. All right, last one. Okay, lung sounds are all clear. I could also, if I had any abnormal sounds, I could also check for his voice, have him repeating those statements 99 or blue moon and listening at the same time. That's another test I could do. Another test I could also be doing during this exam is the diaphragmatic excursion, where I'd be checking to see how his diaphragm, how much it goes up or down with that inspiration or expiration. You would measure and compare the both sides of doing that and see if they were equal and if they were within that normal range. So this, I think, completes the respiratory assessment.